Myth number 2 is a keto or intermittent fasting diet is the best option for heart health.
So many feelings on this. So many feelings.
I'm going to sit up in my chair for a second.
I know,
I'm
like
gonna adjust
everybody
myself
adjust.
Yeah.
for a minute.
We're going to talk keto.
Take power position for a minute because
Like, I'm going to be honest with you guys. Like, I'm being dead serious.
Yeah,
I've never
totally.
been a diet guy. I've just been kind of a pretty healthy eater my whole life. I have no fucking clue what the keto diet is.
okay.
I'm being honest.
Cool.
I got no clue.
Okay.
What is it?
So keto varies because keto originally was devised as a very high fat, very minimal carbohydrate intake, and we found that it was successful in treating pediatric epilepsy. For whatever reason, that by consuming this diet, where it was literally 90% of the calories came from fat, and then very minimal amount from carbon from protein, just enough for basic needs, we found that it was able to treat them. So,
Epilepsy is a seizure disorder.
yeah. So nowadays you've taken it, and keto has taken off as a major trend for weight loss. And the reason being is, again, the idea that you control carbohydrates, or that there's something inherently bad or inherently fattening about carbohydrates, which there isn't, because the goal is overall calorie modification. That's what you want to control. But keto does that by focusing on get the carbs down. And the means of this, just to give you an idea, like a practical measure, usually to do it, you have to consume less than about 50 grams of carbohydrate, and it varies according to the person, which 50 grams of carbohydrate is not that much. That's approximately what you get in 3.5 slices of bread.
Yeah.
So it's very minimal. But once you do, your body eventually gets into this state called nutritional ketosis, where you're using ketones as an energy source. And from that, there is this literature which just demonstrates how people in the short term are able to reduce their weight. They're able to keep their weight off. There's some findings which I think report how it helps with managing your appetite and keeping it under control. That's keto in a short nutshell.
So it's about ketones. Can you remind us real quick how ketones are produced in the body?
So ketones are produced as an adaptive survival mechanism for energy. So your body's main energy source is glucose.
Right.
However, there is an offshoot adaptive mechanism within the citric acid cycle, which I do not need to go into for this discussion. But when your body is not consuming or not producing enough glucose, either by gluconeogenesis or by consuming it, it has this adaptive mechanism to ketones, which is important because your brain can only use 2 forms of fuel. One is glucose, and the second is ketones.
Right.
But the catch to it is the fact that it's not your body's primal form of how it likes to operate, in spite of whatever keto zealots out there would like to say.
Right.
So in terms of heart disease, I actually just looked this up because I was thinking this was going to come up again when we talked about it. The current recommendations are for people who have heart disease or have already experienced an event.
Right.
They do not recommend the use of keto for reduction of risk of heart disease. Because the thing is even though on keto you can lose weights, and that's effectively what the trials do tend to show, is that there is weight loss. The problem is it's a very animal-based diet. And so the saturated fat content, the salt content,
way too high,
triggers higher levels of those LDL particles. Yeah. And so the trade-off on this is, okay, well, my weight's going down, so I'm seeing a reduction in central obesity, I'm seeing a reduction in blood pressure. These are all good things that reduce your risk of heart disease.
However,
but consequently, I'm seeing an elevation in triglycerides, I'm seeing an elevation in LDL, and in some cases, a reduction in HDL. So based on that, we don't really have enough data to suggest and say that it's worth the trade-off. So for people who are at risk of heart disease, we don't recommend using keto as a means to accomplish that and reduce their risk of heart disease.
That is exactly what I teach in my practice. The keto diet is not an option for patients who have heart disease. It's just they're sad. They're not happy with me when I say it because they're like, look at me. They want to be proud.
Right,
I've lost 10 pounds. I've lost 20 pounds.
I mean,
and I'm like, we're going to find another way.
My goal is always going to be patient-centered, and I'm always going to try to help a person accomplish something by what they want to do. So if they come into me and they're just dead set, and if you absolutely want to do this, you absolutely want to give this a try, my recommendation would be, okay, let's set a 3-month period. Let's do a baseline lipid panel and see what these look like.
Yeah.
Let's look at your heart pressure. Let's look at your blood pressure. Let's look at these other risk factors. And 3 months later, let's observe and see. So I can have 3 months later, a person has reduced by this much weight. And then let's look at that lipid panel again. And if the lipid panel has
through the roof,
it's like, you're not responding very well to this because your risk is still pretty high, even though you've addressed the weight factor. But if it's still under control, and if it's not that highly elevated, then on you go. Keep going.